So I think we'll go ahead and get this meeting started this morning. My name is Kristina Young, and I am the SHINE and SMP Outreach and Education Specialist with Elder Options. Hello, and thank you all for joining us today for a talk on Medicare fraud. Today, our meeting will be recorded, so just want to make sure that everybody is aware that we will be sharing this as we go forward live on each of our Facebook pages, but want to make sure that everybody is aware that we are recording this meeting. So as we begin the presentation, we will have an overview of a bunch of different things for all of us to learn about, but joining us today are SHINE and Senior Medicare Patrol team members. Camilita Aldridge, she is the SHINE Liaison with Area Agency on Aging in Southwest Florida. Amy Hagel, SHINE Liaison and Volunteer Manager with the Senior Connections Center. Kathy Sarmiento, our SHINE Liaison with Alliance for Aging. And again, my name is Kristina Young, and I'm going to be your moderator today. Our goal today is to actually describe what some of these acronyms, the ADRC is, the SMP, and MFPW means. We're going to talk a little bit about Medicare fraud and actions everyone can take. We're also going to learn about common scams seen in our state and what an SMP does to help with and why it is important to report any type of Medicare fraud. An ADRC, or the Aging and Disability Resource. That's what an ADRC is. An ADRC, the Department of Elder Affairs administers programs and services for elders through contract agreements with 11 ADRCs, or Aging and Disability Resource Centers in Florida. These centers are independent, nonprofit organizations responsible for ensuring the availability of services to all elders in Florida. The SHINE and Senior Medicare Patrol program contracts annually with these Aging and Disability Resource Centers to provide counseling services within their local communities. Well, what does SMP stand for? SMP is standing for the Senior Medicare Patrol program, and the mission for this program is to empower and assist our Medicare beneficiaries, their families, and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse through outreach, counseling, and education. Last on that acronym list is MFPW. Well, that is Medicare Fraud Prevention Week. It is a celebration for the Senior Medicare Patrol program and its 25th anniversary. We're celebrating 65 years of age on June 5 through June 11th this week. Fraud costs Medicare an estimated $60 billion per year. It costs Medicare beneficiaries time, stress, their medical identities, and even their health. It costs families, friends, and caregivers in worry and lost work when helping their loved ones recover from falling victim to Medicare fraud. Our guest speakers will provide you information on how to protect, detect, and report Medicare fraud, and will be available at the end of the webinar to answer any questions. You may also enter any questions in the chat section. We will address them at the end of the presentation. Thank you again for joining, and I'm turning the program over to Cami.
Good morning, Kristina. Thank you and welcome. So as Kristina said, this week, the Senior Medicare Patrol, SMP, will be celebrating its 25th year, and representatives across the country are spreading the good news. Ways Medicare beneficiaries, caregivers, medical professionals, and the general public can arm themselves with specific tools that protect the Medicare Trust Fund. The SMP is comprised of both paid staff and volunteers, certified through individual contracts between local area agencies on aging and the Florida Department of Elder Affairs. The federally funded program allows representatives of the program to provide education on ways to prevent, detect, and report areas of Medicare fraud and/or abuse. As Kristina stated, the financial loss to Medicare is estimated to be about $60 billion each year. It impacts you, the beneficiary, as well as those needing benefits in the future. Examples of fraud or abuse are found in the following scenarios. 1, charging for services or supplies that were not provided. 2, misrepresenting a diagnosis, a person's identity, the service provided, or facts to justify payment from Medicare. 3rd, prescribing or providing excessive or unnecessary tests and services. So here's the mission of the SMP. It's not just to educate beneficiaries, but to invite their families, caregivers, professional partners, and the community at large to the conversation. Here are some tips for beneficiaries. Let's start with prevention. Guard your Medicare ID as you would your Social Security number and your credit card. Detection. Practice reading your Medicare summary notices when they arrive in the mail. Look for services, products, or equipment you didn't receive. Double check charges or items your doctor may not have ordered. And if you find areas of concern, report them. So the third area, report. Call your local SMP if you believe you have experienced healthcare fraud, errors, or abuse. To caregivers and families, constant queuing might be important. Help by educating yourself and your clients or loved ones on ways to prevent, detect healthcare fraud, errors, and abuse. Remind clients to check their Medicare statements or be on the lookout for items such as boxes with braces or other products just laying around the beneficiary's home. To healthcare professionals, you can help by talking with your patients about healthcare-related scams, such as those related to durable medical equipment or genetic testing schemes. Remind them that products and services should only be ordered by physicians they regularly see. Needed medical items should never be ordered through TV ads or unsolicited calls. And to the public at large, help your neighbors. When in public, be aware of older individuals purchasing gift cards in large quantities. If you overhear someone talking about Medicare fraud, don't be afraid to offer information about the SMP and SHINE. Encourage those you know to talk to a trusted source about their Medicare questions and tell your neighbors and friends about the most recent Medicare scams. And don't forget, there's opportunity for you as well. You may consider volunteering for the SHINE SMP program. And one tip to close out, the most effective way to stop Medicare fraud from occurring is to prevent it from occurring in the first place. The next speaker will share with you examples of fraud. Amy?
Thanks, thanks, Cami, for sharing some great tips to help our beneficiaries not become the next victim of fraud. I will be going over some of the scams that have been reported across our state. One that we have been getting a lot is the cardiovascular genetic testing. And cardiovascular genetic testing fraud occurs when Medicare's bill for a cardiotype of test or screening that was not medically necessary and was not ordered by a beneficiary's treating physician. It is recommended that you always review, as Cami indicated earlier, your Medicare summary notice and watch out for the following if you do not recognize this test on your list. And this is also how it's advertised as cardiac genetic screening test, cardiovascular genetic screening test, comprehensive cardiovascular panel, or as a cardiovascular disease genetic kit. And when you should report, well, you should report pretty much every time you think you see something that it just doesn't sound right. When a company offers you free or at no cost to you testing without a treating physician's order, and then it ends up billing Medicare. Also, when a company uses telemedicine to offer testing to you over the phone and arranges for an unrelated physician or teledoc to order the test. Also, Medicare's bill usually thousands of dollars for a broad, range of cardiac genetics tests that you do not request or even end up receiving at all. Or a company calls you stating that your doctor or cardiologist requested that you have the testing done, and all of a sudden you end up with a kit that you did not request it. And I will be going over a sample of one of the cases that end up starting as a spoofing call of cardiac genetic testing. And if you have never heard of what a spoofing call is, that's when a caller ID, it shows like from a number that you normally will recognize, such as your doctor's office. So this happened to a Medicare beneficiary. She ended up receiving a call from a number from her primary care doctor's office. However, this beneficiary, she's been going for that office for like over 20 years. And she knows that they call her, they use a nickname when they refer to her. So when they end up calling her and they use, her real regular name, she realized that, something wasn't right. She immediately became suspicious. And the scammer was telling her over the phone that her cardiologist requested an additional test and they needed an approval from her primary care physician. And she asked for the name of the cardiologist, and it was a name that she didn't even recognize. So, those two red flags that she received, she ended up hanging up the phone, which is what, you're advised immediately. As soon as you know that something doesn't sound correct, hang up. So she hung up and she ended up calling the office, her office, the doctor's office directly. And she asked, if they had a new staff member because somebody, like they didn't know her name. And they confirmed that, there was no new staff member and they had not originated the call. They also let her know that they had received a fax for a lab request. And it was a lab that it was not very common. Well, they haven't heard before. And the test that they were requesting was called a hereditary cardiovascular profile, which is one of, the scams that, that's one of the names that they're using. And she, confirmed that she was not aware of such, requests from her cardiologist. Also, the doctor's office, realized that they had received an initial, large amount of, of faxes for other people from this, lab. They did a little bit of, research and realized that, the name didn't match, the location didn't match. So all of those are, red flags. The beneficiary ended up collecting all the information and she called the local SMP. And she was assisted. And this is wanted to share that this is one of the multiple cases that are very similar that are going across the state and also on a national level. So Kathy, on to you. You're muted. Go ahead.
Thank you, Amy. Now let's talk about what happens when the SMP counselor interviews you. When that happens, he or she is going to ask you to describe what happened. We'll be writing all of what you're telling us into our computer system that we use to report potential fraud. We'll need to collect your name, address, and telephone number. We'll also need the name and contact information of the person who the fraud happened to, if it's not you. For example, if you're reporting this information about another person, like a spouse or a parent, we would need both of your information. Next, we'll ask you for the Medicare number, and if you also have Medicaid, we'll ask you for the Medicaid number. If you have other insurance like a Medicare Advantage plan or a Part D plan or a Medigap supplement insurance, we will need the name of those insurances and your member IDs also. When we report a doctor or a durable medical equipment company or another entity, we will be asked to share with the reporting system the name of the company, the address, their website address, the contact information, the telephone number, and the date of service that they're billing you for. And a lot of this information can be found on your Medicare summary notice or your statement if you have a Medicare Advantage plan. So we're going to ask you to send us a copy of your Medicare summary notice or your monthly statement if you have a Medicare Advantage plan. We want to see where it shows that fraud. We're also going to ask you if you don't mind being contacted by one of our detectives. Of course, you can say yes or no, but if you say yes, it will help the detectives create a case to convict the criminals. And while it's important to let Medicare or your Medicare Advantage plan know about potential fraud, never, ever should you confront a doctor or a company that is possibly committing fraud. It could be dangerous and it could tip them off that somebody's onto them, excuse me, and they could close up their shop. I hope that I've given you a good idea of what to expect when you're interviewed by an SMP volunteer. Of course, everything that you're telling us and that you discuss with an SMP volunteer is confidential. And in fact, you will be provided with a client confidentiality agreement that says just that. So with that, I'm going to turn it back over to Kristina.
Thank you all for joining again today. And wow, some great information for all of us to learn about and talk a little bit about Medicare fraud. Before we get over to our Q&A section, I would like to see if Kevin, can you please make sure and put into the chat our contact, our website information, where to find information from the FloridaShine.org and the SMP resources, as well as our Elder Helpline. Thank you, Kevin. These are going to be your contacts if you do want to reach out to find your local SMP team here in the state of Florida. And of course, nationwide, the SMPresource.org page is available also for you. Let's go ahead and start our Q&A section before anybody has to leave. So we're here and available to answer any questions. Has there been any Q&A or questions in the chat, Kevin, at this time?
We haven't received any questions yet.
All right, great. So I guess then we can open the floor up to anybody who wants to jump in, if they can unmute themselves. I'm not sure how all the technical side of things is working. So
if you want to ask a question, just click on the raise hand and I can unmute people.
So there's been a lot of talk about Medicare Fraud Prevention Week this week. We have a lot of, every day this week is going to be a new topic. Today we're learning about how to read your Medicare summary notice. Tomorrow it's going to be another topic. Every day it's going to be something new. So you're going to be able to, this actual recording is 1 hour before the actual national SMP kickoff recording of information. So you will be able to see that on the smpresource.org Facebook page as well. We are posting that throughout our different area agencies on aging, or ADRCs. We've learned a lot about different topics this week. I'm hoping that you will join us for some of our local events that are happening and local recordings on Facebook.
We do have a question.
Great.
Laurel asks, are females or males more targeted?
That's a good statistic to figure out. Let's see. I know, just speaking on my own, I think that it happens to just about anybody. I don't think there's a number either way, because I think both sides on my end and all my cases that I've experienced have been both male and female. Anybody else want to jump in on that?
I will, Kristina. Here in Miami-Dade County and in Monroe County, which are the Keys, we've had 50-50. We've had identity theft from a medical provider who didn't really know the Medicare beneficiary. That happened to a male. We've also had a lot of females who were billed for durable medical equipment, especially knee braces that they never ordered and they never received. So it really has been equal, just as it has in your area, Kristina.
Yeah. Cami, Amy?
It's been about the same in my area. They're targeting Medicare IDs. So that's the reason we encourage folks to protect those ID numbers. Because remember, we went from the Social Security numbers being on the Medicare cards to this new encrypted number. So folks are trying to get that number, and it doesn't matter if you're male or female.
Yeah, same in our area. Here in the areas, it's across the board 50-50. Like Amy said, they're targeting numbers, so they are not looking at gender. They're just looking at everybody that they can pretty much target. So they're reaching. They don't discriminate.
I know they don't discriminate. That's for sure. They are really after that Medicare number. That's the ultimate goal. That's the way that they want to go ahead and access the Medicare monies, so that they can scam. They don't really care. I mean, your medical identity is very important to them because it can be sold actually out on the black market also, to many people, and therefore more scams can be perpetrated against your Medicare number. So Cami, that was a great point to mention.
We have a question from Gloria, and I've unmuted her if she
Great.
wants to ask it directly.
Hi,
Thank
Gloria.
you. Hi there. How are you?
Thanks
Ina?
for joining us today.
Yes, absolutely. I was wondering what the proportion for medical fraud is in South Florida. I was in the medical field and I always understood that it was pretty large in comparison to the rest of the state. What are do you have percentage wise?
I don't have a statistic, but it's a $60 billion a year problem for Medicare nationally. So South Florida, I'm sure, is very high.
Is it? Yeah.
Yeah, it's based on population. I'm assuming the larger, the state, the larger the population, the more opportunity to scam.
And I think one of the things that I kind of focus in on is what Cami brought to the table. There are so many avenues of potential. The main thing is the Medicare number, right? But there are so many avenues for them to come about, taking that Medicare number and utilizing it for all types of scams. Amy presented a spoofing call and cardiovascular. Cami mentioned braces, durable medical equipment. There is so many other types of scams out there. The two that we mentioned today are predominantly what's going on right now here in the state. But statistics wise, maybe we can find that out and report back to you. I'm not sure who's tracking that, probably ACL and the team S&P might be able to present that. But right now, I'm not sure if there is a larger population. It's just everywhere.
I was just wondering, and also, do you put alerts out? Like this is my third week with the company, so I was just wondering, is there alert? I would imagine that you guys put out alerts as to what's popular at the moment as far as scams.
We
Yes.
do. We do, Gloria. Gloria, one of the things we'd like to encourage beneficiaries to do is to open their Medicare summary notices.
Right.
So after a physician's visit, a lab visit, somewhere between 45 and 60 days, they're going to get an explanation of benefit or their Medicare summary notice. And what we found, the common factor with many of these cases is that folks are not reading those Medicare summary notices or their explanation of benefits. And that's really their red flag is, whether or not Medicare is being billed for inappropriate charges.
Certainly. Thank you.
We have a question from Milagros saying, has there been a case there where a doctor has committed or been involved in any fraud?
Yes.
Well, I can report on one too. So whoever else wants to jump in, Amy, do you have something? Everybody smiled. So we're like, I think we can all report in on that.
That's because they're at the heart of this.
Yes. Unfortunately,
One tip
yes.
I have for Medicare beneficiaries, if you're seeing a new doctor and you're filling out their form with all of your contact information, when they would like to know your Medicare number or your social security number, I always write upon request. And that way I know who I'm giving my Medicare number to. And it makes it easier to track by when you're looking at your Medicare summary notice or your explanation of benefits, you can see like, hey, something's wrong and it's around that date, that I went to that provider and I gave my number to that person because they asked. So it's one tip.
So I'll share my situation to answer Milagros' question. We did have a local physician who was writing genetic testing scripts, as Amy described earlier, for 10 other states, but he was located here in Gainesville, Florida. We serve the upper north central Florida area, and he has been indicted. He was, however, basically part of the scam. He was the actual, there's a telemarketer, there's the call center, there's those people that are calling to perpetrate, the actual scam, but the physician is putting their license on the line by actually writing those scripts for that genetic test or durable medical equipment. And that's probably, as everybody said, they're the key behind everything. And so yes, we did have a local physician who was caught. He was not even licensed in the other 10 states, but he was writing scripts from the Gainesville location for those other states to help perpetrate. They're getting kickbacks. They're getting money for each prescription that they write, that they sell for that particular beneficiary to get away with a scam. So yes, there are those physicians that are part of the perpetration of these scams, and it becomes, I always call it an octopus or a spider. We have 8 legs. There's so many moving parts involved in our scam, and they happen to be one of those main ones. So thank you for a good question. Anybody else want to add in?
Not only doctor's offices, also those community 55 and up, that hold events. And that's pretty common with genetic testing. That's how a lot of them, they were getting kickbacks, just like the doctor's offices. So yeah, be aware, just because you know the location, you will think, the community director of the place that you live should be a trusted source. But yeah, some of those places as well were involved.
Great question. Anybody else have any other questions? I know that
No questions open. Nope.
nothing out on the chat room. I know that we are, again, having events every day of this week all around, not only in the state of Florida and your local area. So please visit the floridashine.org website to find your local events. They're going to be posted on the main page by county. You can definitely check that out. Again, the smpresource.org page is also available for you to learn more about the SMP program. And I think, Cami, you were the one who encouraged everybody to join us as a volunteer. Our program, would you mind sharing a little bit more about what basically how it comes about as a volunteer if you wanted to join us in the task force here?
Sure. If you found anything interesting this morning that we've shared with you so far, and you think you'd like to be part of our team, you can join us by going to the floridashine.org webpage, click on Join Our Team. There you'll find two hyperlinks. One is the orientation to the program. I would suggest you start there. Many of the things that we do through the SHINE, which is Serving Health Insurance Needs of Elders, and the SMP, Senior Medicare Patrol program, they're very complex, and you have to be a good problem solver. So if you have those great skills that you would like to lend to the program, by all means, go review the orientation. If after completing the orientation, you'd like to join the program, then fill out the application, which is the hyperlink next to that. And we would love to have you in our area. We're serving virtually. Some places we've returned to in person, but it's a wonderful program. Our volunteers have great things to say about our program. So we would love you to be part of our team.
That's a lot of great input, definitely. I'm hoping that will reach somebody out there to join our team as we go forward. And it is, again, a nationwide program. We also have it here in the state of Florida, so we're excited about that. And one other last thing I guess I want to mention, if there are no other questions, unless Kathy, before I summarize anything, does anybody else want to say anything before we go? So Kathy, do you want to say anything, final remarks or anything today?
My final remark is just, to be vigilant, and thank you very much to you and all of my colleagues for really leading the way here in Florida. Thank you.
Amy?
Just wanted to add again that, when you see something that, it doesn't sound right or too good to be true, it's because it usually is not. And trust your gut.
That's a great advice. Great advice. Cami, anything else on your end?
Just be careful when someone says free. It doesn't mean that it's necessarily free. Someone's footing the bill, and typically that's Medicare that's going to foot the bill. So it doesn't just impact you in the moment. It's what's going to happen in the future. And what we want to protect is the future of Medicare for those who are already enrolled and those looking forward to being on Medicare. Thank you for joining us today too.
Yeah, I think that definitely ended on a good note, Cami. The future is really what we do today to protect, detect, and then report. So please, again, check us out. Check out the Senior Medicare Patrol program, SHINE program, Serving Health Insurance Needs of Elders, and we are here to help you. And we look forward to seeing you in the future. Thanks again for joining us. Have a great day, everyone.